Welcome back. We are going to move on now to the lymphatic and immune systems. The organ system is the lymphatic system. The immune system is a functional system that's housed within it. So we're going to start with the lymphatic component in this module. So there's three functions basically to the lymphatic system. The first we hit on when we were talking about bulk flow in the capillaries. The idea that we've got a net loss of fluid to the tissues, and we said it's going to get picked up by the lymphatic system. So we're going to take this fluid that was once plasma, and it gets moved out into the tissues and becomes interstitial fluid, and then as it gets pushed into the lymphatic vessels, it's going to become lymph. Because it did come from plasma, it is very similar in composition to plasma, but we will see some variation by site. So the system returns somewhere in the neighborhood of 3 liters of fluid a day to the blood. So that's a significant volume. It's almost, half or more of your blood volume. We have a function in the digestive system. So we're going to talk about this later in the semester, but there are vessels, lymphatic vessels in the digestive system called lacteals that are going to help us absorb dietary fat. And then the last would be the immune function, the fact that we are housing the immune system here. Okay, so let's talk about this pathway. So we know that the cardiovascular system is kind of a circle. Blood's going to come out, go out to the tissues, and come back. Lymphatic is one-way flow. It goes from the tissues to the blood, basically, right before it gets back to the heart. The subclavian veins is where the lymphatic system hooks back into the blood. So as opposed to kind of the circular nature of the cardiovascular system, we have more of a one-way flow in the lymphatic system. So as we sort of go along this pathway, we're going to find, obviously, the vessels that contain lymph. We're going to find lymph nodes as we go along the way. And then we also have some organs and tissues that we're going to talk about. So the vessels start with what are called lymphatic capillaries. They are blind-ended vessels that are basically mixed in with the blood capillaries. They do have little mini valves in the walls to help move the lymph. They feed into what are called collecting vessels. They're very similar to veins. Those feed into trunks, so you have 6 different trunks that are regional. And all of the trunks feed into 2 lymphatic ducts. You have a right lymphatic duct and a thoracic duct. So here we can see this concept of the blind-ended capillaries. So again, remember one-way flow, so we don't have a flow through here. So we are picking up fluid in the tissues, and it's beginning to flow through. So the question then being with this blind end is, well, how does the lymph get in? And if we look at what a lymphatic capillary looks like, we can see that we've got these kind of like shingled cells. The endothelial cells kind of shingle over the top of each other, and they're not attached to each other. The cells are attached to the tissues. So all of these little proteins and filaments are anchoring these cells to the tissues, so they're not attached to each other, which means that fluid can flow between them. They kind of open up whenever pressure builds out in the interstitial space because there's too much fluid. It's going to push in on these cells, and it's going to allow them to open and have lymph flow in. If we follow the pathway through the body, we can see that it looks somewhat similar to our cardiovascular system, and we definitely see that they do run along with the cardiovascular system. We have areas where we have a lot of lymph nodes. So we've got the popliteal, we've got the inguinal, the abdominal region, the axillary, and then the cervical. We've got some under the elbow. So there are certain areas that are going to be kind of heavily populated with lymph nodes. And then we're going to have a few organs we're going to talk about as well. So spleen and thymus and things like that. So here we can kind of see this idea of the point where the lymphatic system is going to hook back up with the blood and return that lost fluid to the blood. So here we've got our subclavian veins here, and right really at the junction between the subclavian and the internal jugulars is where the two ducts feed in. So this is the thoracic duct over here on the left side and the right lymphatic duct over here on the right. It is not a 50-50 split. The right lymphatic duct deals with basically the upper 1/4 of the body on the right side, whereas the other 3/4 of the body is dealt with by the left side. Okay, so let's talk about the movement of fluid here. It's going to be very similar to venous return. So remember that venous blood was fairly low pressure. Lymph is even lower pressure because it doesn't have the benefit of being attached to capillaries that are attached to arteries, which are attached to the heart, which is a pump. So it doesn't benefit from that sort of circular motion of the blood. And so things like your skeletal muscle action, your same respiratory pump with the pressure changes from breathing, the valves, those are going to be really, really important. We also have kind of a rhythmic contraction that occurs in the walls of the lymphatic vessels. But a lot of these are going to be really important, particularly the skeletal muscle movement and maintaining a good flow of this fluid out of the tissues. If we begin to collect lymph, if the drainage is obstructed or there isn't the ability to move this fluid, then we can get lymphedema, which it looks like this, where we're really having a hard time getting that lymph, that fluid back out, particularly of the legs. That is the most common place to have lymphedema. All right, so we're going to find some cells in this system. Now I'm just really introducing them here because these are really immune cells, and we're going to get into them in the next module. So we've got lymphocytes, so B cells and T cells, so those we've talked about. We have a bunch of what we'll term later second line cells. So we've got natural killer cells that basically are surveillance types of cells. We've got macrophages, which are phagocytic. They're also going to help activate T cells. We've got dendritic cells that are going to help us start an immune response against something that is coming through the skin. We also have reticular cells that are going to produce these fibers that are making up the majority of lymphatic tissues. If you remember back to your tissues, reticular connective tissue was sort of like a mesh bag that was holding together a lot of your lymphatic structures, and so that's what we're talking about here. So if we look at this tissue, we talk about lymphatic tissue. We're going to see proliferation and surveillance basically happening in the tissues. Most of them are mainly reticular connective tissue, and there's kind of two different versions of this. The first is called diffuse. It's not really well defined. It's collections of cells and fibers. It's found pretty much in every organ. And in a more organized way, it's found in what's called the molt. which is mucosal-associated lymphatic tissue. So we've got it in the digestive system, we've got it in the respiratory system, and so we've got a little bit more organized versions of it there. Then we have what are called follicles. These are more organized. You've got a very tightly packed structure that's got your fibers, it's got your cells, it's got generally fairly clearly distinguishable germinal centers where you've got a lot of B cells. You find these follicles in lymph nodes. You find them in other structures, like, for an example, a Peyer's patch that we're going to talk about in a little bit. But basically, the tissue is either this sort of diffuse kind of collection of cells, or it's a more organized structure. And the diffuse is really everywhere. There's not a lot of places that we have no immune response. So let's talk about a lymph node, as that is kind of our primary organ. They're usually embedded in connective tissue. They're very close to the surface in a few areas. So the cervical ring region, the inguinal, the axillary regions, these are where they sit a lot closer, and oftentimes where we can actually feel a swelling that occurs in them when they are being activated. So a lot of times the only ones that people really know about are the ones in the cervical region, so kind of under your chin. And so no matter what they think might be wrong with them, they consistently just feel under their chin to see if their cervical lymph nodes are swelled up. But the way that lymph flows from in a one-way direction from the tissues back to the heart, if you step on a rusty nail, you don't want to wait until your cervical lymph nodes swell to figure it out, because the popliteal ones behind your knee would swell first, and then the inguinal, and then, I mean, it would be a long time before you might be dead by then. So you want to basically look at the lymph nodes closest to the area of the injury. If we think we have a sinus infection, then the cervical region is a really good place to check them out, but not if we've stepped on a rusty nail. Now, what's happening when they swell is an activation of your immune system. So it's an indication that your immune system is working exactly like it's supposed to, and it's doing the job that it is supposed to do. So we have some variety in what they kind of look like, but they are tend to be sort of divided as we look into the structure. So there is this kind of very dense connective tissue that sort of moves inward and subdivides everything into different areas. So we have a cortex where we find a lot of germinal centers. That's where we find a lot of B cells. We have medullary cords. We're going to have B and T cells there. And then we have sinuses where we have macrophages. So we've got several different cells that kind of each has their own sort of place to look at here. There are multiple afferent vessels, but only 1 to 2 efferent vessels, because again, we are trying to converge this as it goes towards the blood. So here in the cortex, this is a germinal center here. This is a cord right here, and then this is a sinus. Okay, so if you look at it in histology, these are all germinal centers, so it's very clear to see what they look like here. And then you've got the cords, which are a little bit darker, and the sinuses here. Oh, also, multiple afferent vessels, 1 to 2 efferent. All right, the spleen is definitely the largest of our organs here. It's very soft, very squishy. It's in the upper left quadrant of your abdomen. It kind of wraps around the kind of lateral portion of the stomach a little bit. The issue with the spleen is that it has a very, very large artery and vein. And so if there's an injury to it, we are at risk of bleeding out. Functionally, pretty much everything it does is mimicked elsewhere, which is why if you are bleeding out and we can't repair your spleen, we will simply remove it. everything that the spleen does is done elsewhere. So we've got the proliferation and surveillance, which happens throughout the immune system, blood cleansing, which the liver also does, breaking down red blood cells, also the liver, platelets and monocytes are stored in multiple places, and even fetal red blood cell production has multiple regions that is going to do it. The spleen is one of them. And so if we can't repair it, we will remove it. That being said, we now understand that our immune system functions better with all of its parts. Crazy idea. So we tend to try to repair them, and our surgical techniques have gotten a lot better. But remember kind of what you're dealing with. You're dealing with kind of like a mesh bag filled with cells. It's not the easiest thing to repair. We've got white pulp and red pulp in there that we're going to see our white blood cells versus our red blood cells. Here are a couple funny comics that you can look at that have to do with the spleen. Basically, the idea that everything it does is done somewhere else, so it always feels bad about itself. Alrighty, so here is what I'm talking about by a gigantic splenic artery. So you can imagine that if this thing is torn up due to trauma, that there's a lot of blood that flows through here. It's, that's a big artery, and that's where the danger is. And then you can see we've got our red pulp out here and our white pulp there. The thymus we're going to talk about more later. It is a basically schooling site for T cells. So we're going to talk about the University of the Thymus later on. It's very large in a fetus and an infant, and then tends to degenerate as you age. So here you can compare the fetal heart to the thymus, and they're roughly the same size. And in an adult, the heart is this size and the thymus is this. Eventually, it basically disintegrates into a little piece of connective tissue. There certainly are repercussions to this that we will talk about in the immune system. And lastly, we've got the mucosal-associated lymphatic tissue. So we're going to expand on that a little bit. So think about all your mucous membranes. So we're talking respiratory, digestive, the urinary. It all has this mucosal lining, and so we need the immune system to be right there. I mean, these are all open to the external world, so we need the immune system to be right underneath there, so that if something begins to breach that first line of defense, we're able to alert the immune system and get things going immediately. So the tonsils fall into this. So we have 3 sets of tonsils, and this is kind of what they look like. They have these crypts where you find all of your germinal centers where we can start an immune response. They are there to guard the oral cavity, the nasal cavity, things like that. They are definitely what tend to get infected with strep. So these are your little tonsils here that have been removed because they had too many streps. Again, we are now trying not to do that. We used to just yank people's tonsils out without really even thinking, but it turns out, again, the immune system functions better with all of its parts. So it's, we want to leave them in there if at all possible. The Peyer's patches that I had mentioned earlier, these are clusters of follicles that you find at the distal small intestine. So the far end of the small intestine that's going to meet up with the colon, where you just have just a huge amount of microflora that could be a problem for us. If it backflows into the small intestine, we're going to have the the immune system right there. Everything in your immune system functions better on early warning. Okay, we want to try to make sure that we're right where something could go wrong. Your appendix falls into this. It's filled with lymphoid follicles, so you've got all of your B cells and the germinal centers and things like that that are there to deal with anything that kind of gets out of hand there. Now, the appendix in humans is completely vestigial. It is sitting there. It does have the follicles, but it doesn't appear to be doing all that much for us.